Welcome back to Afternoon Live. Feeding your dog is just part of the everyday routine, but this simple act could lead to a very serious, often fatal condition called bloat. Here to explain what bloat is and how this emergency situation can be avoided, we welcome back Veterinarian Dr. Cherice Roth. Thanks for joining us. It's great to see you.
Yes, always a pleasure.
This is a tough one because it happens quite often, but a lot of pet people don't know about it until it happens to their dog.
That's exactly right, and that's why this part is so important, is having the discussion so that you can recognize the signs.
Okay.
Yeah.
Can you tell us more just to start with what bloat is and some other names for it?
Yeah, so bloat is kind of what we call, it's the common term, but what it actually is gastric dilatation in volvulus. So gastric meaning the stomach, dilatation meaning that it dilates or gets really big, and volvulus means actually twists. Okay. So we call it GDV for short, because it takes too long to say gastric dilatation in volvulus. But what happens is that food, air, gas, water, other objects can help to weigh down the stomach. And if that is full, what happens is the pet starts to play or something else occurs and the stomach can actually flip on itself.
Goodness.
And think about that. That means you've taken both ends of the stomach and you've closed it off.
Oof.
Right? And so they can't swallow things. And so it looks like they will be trying to vomit because it doesn't feel good. It hurts and nothing will come up.
Interesting.
And they can't swallow their saliva. So you'll also start to see a lot of drooling and their belly will start to get bigger.
Okay.
And that's because of the accumulation of the gas that they would normally burp or fart out that can't go anywhere.
Stuck.
Yeah, and then to add insult to
uncomfortable.
injury is that the spleen is also attached to the stomach. And so often with these guys, you'll also see splenic damage as well.
Oh,
it's a horrible condition.
that's so awful.
It's quite terrible to witness. And what's so important about talking about this is that if a pet parent can see and recognize the signs,
yes,
they can help their pet. They get to superhero for their pet that day.
Okay, so
Absolutely.
you've mentioned a couple things already. Also, restlessness could be a potential symptom.
Yeah, so often what that'll look like is just pacing. Right, walking around, being uncomfortable, can't lay down. We call that, it'll be restless.
Okay,
Yeah.
and then the swollen abdomen, that unproductive retching where it seems like they're trying to get something out, excessive salivation, rapid breathing also.
Yeah, because it hurts, right?
Oh,
and as
man.
that stomach gets bigger, it starts to press on their lungs, right, on their diaphragm, and it makes it harder for them to breathe.
How much time do you have to take action once you notice some of these symptoms kind of adding up?
You have 30 minutes to an hour.
Oof.
And so think about that. I mean, we run errands and we're gone for longer than that, right?
Yeah.
And so it is something that often, unfortunately, some pet parents will just come back and find their pets deceased.
Wow, it can just happen that quickly.
It can happen that quickly.
Okay.
And so in those cases, I highly recommend getting a necropsy, which is it's basically an autopsy of what happened so that you have an understanding for that closure. But it really is, they have to have surgical help immediately.
Okay, if you are able to take action, what's the first thing to do?
Yeah, so there's absolutely nothing you can do at home.
Okay.
That's the part that's so crappy,
Get help right away,
You have to know where that ER is.
Okay.
We've talked about that, of just kind of how to be the best pet parent you can. Know where the ER is, and it's something that the teams are well trained in. If you say, hey, I think my dog is trying to vomit and can't, which is usually, some people will think there's something stuck in their throat or something like that. We know what that means, and it is all hands on deck to try and save that animal immediately.
That's comforting to know that when you have to get there,
They
everyone knows what to expect.
I'm actually getting chills because I've seen and done so many of those calls.
In the moment,
and it's kind of terrifying, right? For the staff, we're worried, the pet parents are worried, and we just go to work to try and save their lives.
Yes. Okay, let's talk about some of the risk factors to be aware of. Are certain breeds at higher risk?
Yeah, so your large breeds are typically the ones that we want to worry about the most, but really it can be any dog with a deep chest. And so my record, it's not a great record, but I actually have done a GDV surgery on a dachshund because they are technically deep-chested, even though they're little.
Those tiny little bodies,
so as long as there is space for that stomach to rotate, it can and will. But Great Danes, German Shepherds, Boxers, any of those really deep, beautiful, barrel-chested doggos are highly at risk.
Okay. Age, does higher age mean higher risk?
Yeah, it does. I mean, and some of it is, they've been alive longer, right? And the odds that they've beat the odds each year by not having it happen. And so, they're older. Some of their connective tissue may be a little bit more lax because everything goes when you get older. But being big, being a bit older. Another is being fed one big meal a day.
Oh, okay.
And so what that means is that if you do have a large breed dog, what you're going to want to do is divide up their meals throughout the day if you can. If you can't, do a slow feed bowl.
Those are great.
I have to have them because we've talked about my Doberman. He does the most all the time.
He's on a mission.
And so what that does is it helps them to regulate how much food they're taking in, and it takes them longer to eat that large amount.
And then exercise, just how much, I guess, vigorous activity they're up to?
Yeah, I mean, you want them to be able to run, jump, and play and do all of those things, but try to at least have them chill out for an hour or two after that really big meal, or after any meal, really.
And then what to know also on top of the feeding, what water habits should we be watching for too?
Yeah, so we watch for those that are eating the big meal and then try and go gorge themselves on water, because that's going to really fill up the stomach even more and make those food particles swell.
Okay. What about surgical prevention? What's the option there?
Yeah, so I can actually go into the pet's abdomen, take their stomach, and attach it to their abdominal wall.
Wow.
And that is, it sounds really complicated. It's actually really relatively easy procedure.
Okay.
I highly recommend it for any large breed dog. If you're getting them spayed, we're in there anyway.
Right.
And it decreases the chances of this happening down to 5 to 10%.
Oh my gosh.
I mean, this is a life-saving procedure. Like
That's a
all
big
of my big
change.
dogs, all of them, we gastropexy because it is something that is so important. And like I said, we're in there anyway most of the time. Or if they're under for castration, we can absolutely still open their belly and get that done. It's quick procedure, and it saves their life.
Yeah, just that peace of mind too, once it's done, to know that that teeny tiny percent is all that's left.
Yes, and it is absolutely life-changing.
Okay. Oh, thank you so much for stopping by.
Course. It's a heavy topic.
I was going to say, but it's good to know what to do and that we all have options to take care of our pets as best we can. Great to see you.
You too.
We'll have more information on our website at katu.com. We'll be right back with more Afternoon Live right after this.